Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me for this video. Today we're going to be extracting tooth number 2, an upper right second molar. There you could see the tooth had broken a while ago. I recommended the patient get a crown to fix the tooth. Patient declined, got busy, and here we are 3 years later. Tooth starting to hurt. Hurts when I tap on it. So treatment choices were to root canal it or to extract it. Patient decided second molar, let's get it out of there. So first I make sure the tooth's nice and numb, and the first instrument I use is my spade proximator. I just put that in between that tooth and the bone there and try to make some space for my next instrument, the 301 elevator. This is a little bit thicker and it's a little bit stronger, so you can use a little bit more strength. And there you can see it's actually got the tooth moving a little bit already. Great to see. And now hopefully I got enough room. I'll use my Dr. Murph Crane pick to get in there and remove the tooth. Now sometimes I know Dr. Murph can just kind of jab it in there. That's the only instrument he uses to remove these teeth. For me, I still struggle with it a little bit. I'm having a little bit of trouble. Not enough room for it, so let me go back to the 301. And again, I got it moving, so that's always a great thing. And let me try to make a little bit more room. Now, sometimes when the tooth is moving like this, but it doesn't want to come out, you can see right there how much movement I'm getting, which is a good sign, but it's still not popping out. That usually means there's going to be some hooks or some twists on the root tips that are preventing it from coming out simply. So I don't like to rush it. I like to go slow, try to work it, try to expand the socket to get the tooth out, because what can happen if you use too much pressure too quickly, the root tips can snap off and then you're going to dig those out. And again, back to the spade proximator. I'm working it on the mesial side in between the teeth, and then I'm also going to try to separate the back. And here I'm using a distal angled proximator to separate the tooth from the bone behind it. So let me pull up an x-ray. The bone behind the tooth, that's part of what's called the maxillary tuberosity. It's basically a lump of bone on the back end of the upper jaw. And what can happen whenever you're removing upper wisdom tooth or the last tooth in the mouth, like this is the tooth number 2 because the patient already had his wisdom teeth removed, that part can break off and come out with the tooth. It's not a big deal if it happens, but it does freak you out as the dentist, the person extracting the tooth, because all of a sudden you see this instead of just the tooth coming out, you got a big piece of a bone attached to it. Usually if that happens though, we just suture it up, it heals up, patient doesn't even realize it's missing. Of course, we always tell them that when it happens. But what I'm trying to do with the distal angled proximator is prevent that from happening. So I just work it in between into the PDL space between the tooth and the bone on the back side, just to give me a little bit more separation, and again, just expanding the socket, try to get it moving. Now I'm back to the Dr. Murph Crane pick, seeing if I can get it moving, and again, it feels like I'm having a hard time getting the crane pick in there. So let me switch over to some apical retention forceps, see if I can muscle that tooth out. And one thing though, this tooth's got a kind of a funky shape to it. It's kind of small on the palatal side, so I'm having a hard time getting a good grip on it, trying to squeeze it, and pop, there goes the crown. Well, not the crown. It's basically the last little bit of tooth that was left and then the large white filling that was in there. And I can move the tooth a little bit. I get in it wiggle, but I actually can't get that great a grip on it with the apical retention forceps. But now that I put some pressure on it and I got a little bit more space with the top part of the tooth off, I'm going back to the 301, and now I'm getting a lot more movement. So hopefully that loosens it up enough where I can remove it. And now back to the Dr. Murph Crane pick, and you can see I got enough space for it, and I'm moving it. And I'm not leveraging off the tooth in front, I'm leveraging off the jawbone in between. And there it is. It comes out, got it out. Let's take a look. Got it out in one piece. Awesome. Let me check, make sure there's no opening into the sinus. You can see where the root tips were, and if you look close, that mesial buccal root, it's pretty wide. It's much wider than it normally is. It's almost like it's two roots fused together. So that's, I think, what was preventing the tooth from coming out easily. But everything looks, there's no opening into the sinus, which is great. But I did notice this loose piece of bone on the buccal side, this little bit right there. Let me just grab that with my cotton pliers. And then I'm just checking for any other loose pieces. Now, normally, if the bone on the buccal side of the tooth breaks off, that would be an issue if the person decides to get a dental implant. You would need to do a socket graft. You'd have to put some membrane on the side to let it heal. So you'd have enough bone to place an implant. This situation is the second molar. I believe this person's already missing his second molar on the other side, on the upper left. So he's not getting a dental implant in that area. So nothing we have to worry about. We're just going to let it heal up on its own. All right, checking around, getting rid of any loose tissue. And here's a close-up of the roots. And there you can see how that mesial buccal root, the tip, hooks in, and that's what was preventing it from coming out in one piece. All right, thank you all so much for watching. Hope you enjoyed this video. Please consider subscribing if you enjoy dental content, and likewise hit that thumbs up button. It really helps me out with the YouTube algorithm. Even though these bloody videos YouTube does not like to share and have people look at. All right, thanks so much.